Infectious diseases are classified according to the mode of transmission into droplet infectious diseases, foodborne infectious diseases, contact infectious diseases, and arthropod-borne infectious diseases. At first, we shall discuss droplet infectious diseases. Two diseases will be discussed. They include measles and mumps. In each one, we shall start by discussing the epidemiological features of it. So, measles is acute, highly infectious disease of childhood. It is characteristic for childhood period. The causative organism is measles virus, which perishes within hours outside the body. Yani it's so delicate. Regarding reservoir of infection, very important to be known in MCQ exam. Reservoir of infection in measles cases, no carriers. Regarding the infectivity, the virus finds exit in nose and the throat secretion. Throughout the disease, about 9 days during two stages, catarrhal stage and rash stage. Catarrhal stage for 4 days, in which infectivity is more. Rash stage about 5 days, in which infectivity declines. Modes of transmission. We are discussing epidemiology of measles, starting by causative organism, reservoir of infection, infectivity. Then modes of transmission. First, modes of transmission include direct droplet infection, airborne infection, using articles freshly soiled by throat secretion through a third person. Direct droplet infection by droplet nuclei in confined places. Airborne by droplet nuclei in confined places also. And we mentioned before, droplet nuclei even are very light droplets in the air, carrying the causative organism and inhaled by a susceptible. Thirdly, using articles freshly soiled by nose and throat secretions. Fourthly, through a third person who nurses the case. Incubation period. Very, very important. In ultra short questions of any exam, incubation period for measles is 7 days, 8 days, 9 days, and 10 days. We shall choose 10 days. So, incubation period is about 10 days. Clinical manifestation, it is characterized by 3 stages. First, catarrhal stage. Secondly, eruptive stage. And thirdly, convalescence one. Catarrhal stage It is the prodromal stage, starting from onset of disease until rash appears. It takes about 4 days. It takes about 4 days. Starts by high fever, about 40 degrees or more, followed by headache, malaise, then respiratory catarrh with sneezing, sore throat, obstructed nose, and dry irritating cough. Then conjunctivitis and photophobia, very, very important, to be followed by the most important sign or pathognomonic sign of measles, which is known as Koplik spots in every exam. Koplik spots, either true or false, or choose one from multiple. So Koplik spots are the pathognomonic sign of catarrhal stage, which appear on the second days of disease and disappear with development of rash. They look as scattered tiny table salt crystals distributed on dull red background mucous membrane of mouth. The second stage is eruptive stage. The skin rash usually appears 4 days after onset of disease and lasts for 5 days, to end with fine branded squamation. Once the rash develops, improvement of the general condition will be followed and the clearing up of respiratory catarrh. The last stage is convalescence. Begins when eruption and brain-like squamation appear. Measles may undergo one of the following forms, either typical or classical cases, or mild attenuated cases due to existing partial immunity, نتيجة maternally acquired or by seroprophylaxis. Lastly, the severe cases. Complications of measles, very, very important. Either enumerate complications of measles. Complications of measles mostly caused by secondary bacterial infection, first. Secondly, by exacerbation of tuberculosis, and rarely by measles virus. Firstly, secondary bacterial infection may cause otitis media, sinusitis, cervical adenitis, and acute respiratory infections. Acute respiratory infections will include bronchitis, pneumonia, bronchopneumonia, diarrheal diseases in young children, and purulent conjunctivitis. Secondly, tuberculosis. Severe measles in debilitated children may cause exacerbation of dormant or quiescent tuberculosis. Measles may also be associated with temporary suppression of tuberculin action in the effect. Thirdly, measles virus may cause viral bronchopneumonia and rarely encephalitis. If encephalitis occurs, it is severe case of measles. Fatality. Measles by itself is benign. The fatality is due to complications, especially acute respiratory infection, including acute respiratory, diarrheal disease, and the encephalitis. The age incidence in the unvaccinated or in endemic areas. Susceptibility begins after the age of 6 months. Why? After maternally acquired immunity fades. The highest incidence is found in preschool children of 3 to 5 years. However, by the age of 10 years, most children would have been exposed to infection and got the disease, while those who have escaped the infection and the disease during the childhood period remain susceptible and they may get measles at any age. Prevention of measles. Immunization is the only preventive measure. استخدم الميسلز vaccine. Type of measles is live attenuated one. Compulsory vaccination of infant in Egypt is at 9 months. Very, very important. Compulsory vaccination of infant at 9 months. Vaccination of susceptible, giving no history of measles before, will be given the measles vaccine or active immunization. It is given in a single dose of 0.5 milli subcutaneously. Seroprophylaxis. It is done by immunoglobulin. It is preferred. It is to be given after vaccination. يعني by immunoglobulin is preferred. It is followed by vaccination for protection. يعني so we give seroprophylactic immunoglobulin, then give the usual schedule of vaccination. Not before 3 months of giving immunoglobulin. Why? Otherwise, still existing antibodies would interfere with the protective immune response. Protective value. Vaccination gives solid lifelong protection. Very, very important. Type of immunity gained from vaccination. Solid lifelong protection is more than 95% of vaccinated susceptible. Some individuals, however, may get measles thereafter. Why? لأن البروتكشن gained is not absolute. A type of protection, solid life immunity, not absolute. Also, infants are vaccinated early, while maternally acquired immunity still persists. So there would be less immune response, which may not be so effective. Also, used vaccine may be inactivated due to negligence of cold chain, as the vaccine must be kept at low temperature throughout from leaving laboratories and until given. Seroprophylaxis through human normal immunoglobulin is given to susceptible contacts of any age for seroprevention or seroattenuation. Seroprevention, measles is prevented by giving first adequate dose of immunoglobulin. Adequate dose of immunoglobulin, 0.25 milli per kg body weight, intramuscular. At what time? Within 6 days of exposure to infection. It is protective for at least 6 weeks. So it is given so early, within 6 days of exposure. The protection period is for at least 6 weeks. It is seroprevention. The second type of prevention in cases of seroprophylaxis is seroattenuation, when the susceptible is given in a smaller dose of immunoglobulin within 6 days. So, if the susceptible is seen so early after exposure to infection, the immunoglobulin is given in adequate dose at once. It induces, in such a case, seroprevention. The second case is that if the susceptible is seen later, after the 6th day of exposure, seroprevention cannot be obtained. The usual dose of immunoglobulin is given for seroattenuation. The second droplet infectious disease that will be discussed is mumps, epidemic parotitis. Very, very important. It is an acute infectious disease characterized by either generalized infection in viremia or localization of infection in the salivary gland, commonly the parotid. Regarding the epidemiological features of mumps, causative organism is caused by mumps virus, which is myxovirus, relatively resistant outside the body. Reservoir of infection, very important, man including cases and the incubatory carrier. Also very important to know that the virus finds exit in saliva. Mumps virus finds exit in saliva. Reservoir of infection in mumps is cases and the incubatory carrier. Period of infectivity from the last days of incubation period and throughout the disease until swelling of salivary glands subsides completely. Mode of transmission. 3 modes of transmission are known. First, direct droplet, saliva contaminated article in utero. Direct droplet infection is considered the main method of spread. Saliva contaminated articles and the vomits represent the second mode of transmission. Also, in utero infection which is a potential risk. Incubation period, very, very important. 18 days on the average. Incubation period for mumps is 18 days. Incubation period for measles, the average is 10 days. Clinical picture, prodromal period, constitutional manifestation, including fever, headache, body ache for 1 to 2 days before swelling of salivary gland. Swelling of salivary gland, very, very important. The characteristic feature of mumps is swelling of salivary glands, right? The parotid glands are the commonly affected ones, right? While submaxillary and sublingual are occasionally involved, either together with or rarely without the parotid. In cases of parotitis, which is the commonest form to be involved, bilateral, tender, painful swelling, lasting for 3 to 5 days. After that, it resolves and subsides after 1 to 2 weeks. Complication of parotitis. Complications of parotitis. Very, very important questions. Either mention complications of parotitis or enumerate. Complications of parotitis may affect adults commonly, but may affect children occasionally, and include orchites. In order of sequence, they are very, very important. Autists may undergo atrophy. This atrophy is unilateral, usually unilateral, but may bilateral, causing sterility. Secondly, oophorytes. This type is of less incidence than orchites. Thirdly, mastitis in both males and females. Fourthly, pancreatitis, which is an interstitial pancreatitis, interstitial hemorrhagic type of pancreatitis that may be followed by diabetes mellitus later in life. Later in life. Fifthly, meningoencephalitis, which is usually benign. And lastly, congenital anomalies, particularly if infection occurs during the first trimester of pregnancy. Fatality rare. Susceptibility in endemic area. There is maternally acquired immunity for around 6 months. Clinical attack is usually followed by lifelong immunity. Lifelong immunity, type of immunity in cases of mumps, is lifelong immunity, which is different than the type of immunity gained in cases of measles, which is a solid type of immunity. Prevention, active immunization, and seroprophylaxis, similarly to measles. Active immunization by mumps vaccine or MMR vaccine. MMR vaccine is triple vaccine against measles, mumps, and rubella. measles الحصبة, mumps, النكاف الوبائي, and rubella الحصبة الألمانية. Mumps vaccine also is live attenuated, given to whom? To adolescents and young adults who have not had mumps before. It is given in a single dose of 0.5 milli subcutaneous, the same dose of measles. Single dose of 0.5 subcutaneously. MMR vaccine, which is triple live attenuated vaccine of mumps, measles, rubella. It is given to susceptible adolescents and young adults also, but with particular emphasis to be given to females before marriage. Why? To prevent abortion later on in life. Also in a single dose of 0.5 milli subcutaneous. Seroprophylaxis. Specific immunoglobulin in adequate dose when exposed to infection. Adolescents and young adults and young cases of mumps immediately when parotites appear, to prevent involvement of other of the body causing complications. Thanks.